Hi, everyone. My name is Dr. Nicholas Essenplayer, and thank you for joining my webinar today. We're going to talk about shoulder issues in the active individual. So let me get my slides up. All right. So like I said, we're going to talk about shoulder injuries in the active individual, just some common things that I've seen as I practiced and some things that most people that are active, whether they're gym active, sports active, have come in and complained of. So real quick, I want to go over some anatomy of the shoulder joint, just so we're on the same page and understand where we're coming from. So you have the glenohumeral joint, which is right here. So that's the shoulder joint itself. That's the one that moves around and stuff like that. But your shoulder actually has a bunch of different joints to it that make it up. So it's kind of complex, but we'll go over that. So you have your glenohumeral joint here. You have your AC joint, which is your acromioclavicular joint, where this is called your acromion, and it attaches to your clavicle. And then you have your scapulothoracic, which is back here, and that's the one on your back. That's your shoulder blade. That's the shoulder blade joint that moves when you raise your arm and things like that on the back. And then you have your SC joint, your sternoclavicular joint, which is right here. All of these have to work together to help the shoulder move. We're going to mainly focus on the AC joint, the glenohumeral joint, and the scapulothoracic joint. Those are three we're going to focus on today. And so I want to talk about some muscles that your shoulder joint is made up of, and it kind of helps it move properly and things like that, or where some of the issues may lie. So you have your rotator cuff. Most people have heard of the rotator cuff. It's actually 4 different muscles. So your rotator cuff consists of your supraspinatus, your infraspinatus, your teres minor, and your subscap. So supraspinatus is right here, and that wraps around, and it goes under the acromion to the front. Then you have your teres minor, which is right here. You have your subscap, which is on this picture. It's on the back of that shoulder blade. So it's on the inside of the shoulder blade, right against your rib cage. And then you have your infraspinatus, which is right over here. So they all work together to help raise the shoulder. So these muscles are all very important in shoulder mobility because they act together to depress the shoulder when it's moving or stabilize the shoulder, as well as they work to do different motions of the shoulder for you. So it's very important that those muscles are strong and they are working properly while you're doing activities. Other muscles that are involved with the shoulder joint are the deltoid. That's that big one right there. That's the one that most people see on people. It's that like cup on the outside of the shoulder. That's your deltoid that helps with elevating the shoulder. You have your lower and middle trap. You also have your upper trap, but most people know what that is. So this is your upper trap right here. You have your middle trap right here, and then your low trap. I specifically put low trap, middle trap in there because I think those are the most important with shoulder issues. That's my personal opinion. They chronically get overstretched from poor posturing or poor posturing during exercise. So we want to make sure those are nice or strong and activate in an appropriate manner when you're lifting your arm. You have your serratus anterior, which is not pictured, but that's along the rib cage on the side. And that helps also lift the shoulder blade up correctly, as well as lifting your arm up correctly while you're doing any overhead motion, overhead lifting, or putting things away in even a cabinet. Basic daily activities, those muscles activate. You have your rhomboids, which are the ones back here, and those work on pinching your shoulder blades together and elevating them, and they also work in unison with the controlling shoulder mobility and motion. And then lastly, you have your pecs, and those are in the front. Those are not truly a shoulder muscle, but they can attribute to shoulder pain because they chronically get over tight because of just poor posturing or just the way we're sitting all days long with our forward shoulders. So I wanted to focus on those pecs too because they can get tight, and a lot of people have tight pecs. So that's something I focus on personally when I treat patients with shoulder issues, is loosening up their pecs. So common shoulder injuries, the first one we're going to talk about is impingement syndrome. Impingement syndrome is you just get impingement of the muscle tendon under the acromion. So that AC joint I talked about, which is right here, the muscle tendon, usually your subscap, presses on the acromion right there, and it kind of bounces against it. How that happens is because the rotator cuff muscles sometimes are not strong enough to depress the shoulder, so they have to move down. The shoulder has to move down while your arm is moving up. So that glenohumeral joint has to move down, and the shoulder itself, the arm looks like it's moving up. So if your rotator cuff is not strong enough to depress it and work together as your arm's moving, then you get impingement because there's not enough space in there to allow for proper movement of the shoulder. So a lot of people get that impingement syndrome in the front of their shoulder, and that can lead to shoulder pain. A lot of people get it just because of just poor positioning of the shoulder, and their muscles aren't activating the way they're supposed to. Your low trap and your mid trap also control that mobility of the scapula when it's raising, and you want to make sure those are nice and strong so you don't get the impingement syndrome as well. And then your tight pecs, like I talked about, those will lead to impingement syndrome as well because the shoulder is forward in a bad position and there's not enough space. So a lot of it comes down to how much space is in the joint when it's moving. And if your rotator cuff is strong and your pecs are loose, you should be okay and you shouldn't experience impingement syndrome. And that's what I focus on treating when I see somebody with impingement syndrome, is loosening up their pecs and focusing on strengthening the rotator cuff and the posterior muscles in the back over here. Next one is rotator cuff pathology. So I just put that in and group them all together, whether it's a tear of the rotator cuff, you have full thickness, partial thickness, it depends on the level of tear. You have like a strain of one of the rotator cuff muscles, things like that. So tendinitis. So I put them all together. A lot of times people live with rotator cuff pathologies like tears and don't even realize it. Studies have shown that 8 to 43% of people have asymptomatic rotator cuff tears and don't know about it. So you only know usually if you're experiencing some type of pain and things like that. And you want to, it's one of those things where if you're noticing you're having shoulder pain, you should probably get it looked at, because you want to make sure you want to address it earlier than later. You don't want to let it linger for too long and stuff like that, because it could be an underlying issue, and PT can really help fix those problems, and getting it looked at early can really help fix those problems earlier than later. And so what we focus on with rotator cuff pathology is improving those 4 rotator cuff muscles. Usually they all do their own movements, so you can tell which ones are weak, and that's where we focus on strengthening. And if those improve, then usually your pain goes away, and we want that to keep going. And we also work on proper positioning of the shoulder joint by improving mobility, strengthening the low trap muscles, the serratus anterior muscles, the mid trap muscles, and loosening the front. So a lot of it is strengthen the rotator cuff, but also address the other muscles in the back and fix the typical posturing that we may not be aware of throughout the day. Tendinitis or tendinopathy. So tendinitis or tendinopathy is usually just the inflammation of the tendon that's working too hard. It's coming down to the tendon's doing something it doesn't want to do. And because of that, it gets inflamed and annoyed, and it lets you know that, hey, listen, I'm working harder than I have to here, something's going on. And that's usually what happens. When we have pain, our body's telling us something's wrong, please fix me. And so what happens is you want to look where it's coming from. Sometimes you get in the biceps, sometimes you get it on a rotator cuff muscle, and you want to see why that could be happening, whether it's a muscle weakness, whether it's the joint position, is it not in the right spot, is it needs more mobility, it's too stiff, is it too loose, or is it the back muscles are too weak, or the front muscles are too tight. There's many components to it, and you want to make sure that you're addressing the right component. And tendinitis is normal, it happens. A lot of people get it. You have to calm it down and strengthen the appropriate muscles to improve your symptoms. So whether it's, let's say your supraspinatus is the one that has tendinitis, you need to make sure you're strengthening that enough so the tendon takes pressure off the tendon. And then you want to address everything else around the area, because it's your whole body we treat, not just one specific muscle. That's just how I treat, and that's how most physical therapists work, is we treat the whole body. It's the whole picture, not just one area, because your tight pecs could lead to weak traps, which could lead to impingement, which could lead to tendinitis. So it's a whole gamut of things. So you want to make sure you're addressing each one of those components. So ways to improve your shoulder mobility. Improve posture. I kind of talked about this before. You want to make sure that your shoulders are back, your posture is good, because if we have those forward shoulders, it's not ideal for our shoulder mobility, and it leads to decreased pain and decreased joint issues if our posture is good. And it leads to optimal movement of the body, which means you can lift more, you can do more activities because you'll be in less pain, and you'll be not have to take time off because of pain or discomfort. You want to strengthen certain muscles. So you want to improve strength of the posterior muscles, which were the traps I was talking about, the rhomboids, these guys, your lats, your serratus anterior, and you want to also improve muscle strength of the rotator cuff. Those are all very good things to improve strength on, so that we have less likelihood to have an injury to the shoulder. And you want to stretch the capsule, which are specific stretches that I would show somebody to stretch the shoulder capsule. That's just the joint itself. And the muscles, which would be the pec muscles, are the main ones you'd want to stretch. Some of the neck muscles as well, but the pec muscles are the ones I focus on when I'm stretching with most people with rotator cuff or any type of shoulder pathology when they come into me. And then I want to show some exercises to improve strength, flexibility, and posture. So there's going to be 4 exercises. And so this one is a low trap Y, it's called. So what you're going to do in this one is you're going to pull your shoulder blades back. You're going to do a row, it's called. So you pull back this way, and then you squeeze those shoulder blades together. And then you'll see me punch out straight this way, making a Y. And this one you can do, I'm over a ball in this one. You can do this. So you can do this one as, let's go back to that. You can do this one over your bed, on the floor. You could do it either way, but I'm over the ball just because I have a ball. If you have a ball at home, great. Most people don't, but you'll see right here when I'm punching out straight, it goes straight out, making a Y. So you want to roll back, pull those shoulder blades together, and then punch straight out, making a Y. And then we'll go to the next exercise, which is a mid-trap T, or just a T exercise. You may hear people refer to it. So you're going to start with that same thing where you pull back, squeeze those shoulder blades together, and then you're going to make a T. So you'll pull back, and then you'll punch out to the side. So you'll see me in this right here. I'm starting to punch out to the side, making that T right there. Very poorly drawn T, but that's, and you'll go as far out as you can with this one. And as far out as you can with this one. So that's the, the T right there. So let's see. Just go over it one more time. So you're going to punch out as far as you can comfortably. And then you make that full T right there. And that's what happens with the T exercise. Like I said, it's for the mid trap, and you want to focus on squeezing back those shoulder blades and punching straight out. The next one is an I, or a low trap I. Same concept. You're going to start with that row, and then you're going to extend your arms and lift up. So you're going to extend those arms straight after that row. And then from there, your shoulder blades should be squeezed together here. And you're going to lift up your chest muscles from there into the, off the mat, whatever you're working on. And you'll see at the end right there. So you're going to lift your chest off the mat, ball, whatever it is, to really get the muscles all in the back to fire nicely. So you pull back, you straighten those elbows, and then you get these to fire. And then last one is a doorway pec stretch. So this stretch is great. I love this stretch. I show it to all my patients because I think it's wonderful for the stretch, and most people have doorways at home, or you can use the corner of 2 walls joined together, or you can do one side over the other if you can't seem to fit your arms across. But this is how the stretch works, is you walk forward and you just lean forward. And so you can see I'm just leaning into the stretch there. You hold that for 30 seconds and you go from there with that. And you should feel a nice stretch all in the front of the muscles right around here. It's a great exercise to stretch your pecs. I love it. I use it all the time. And I would say use that with the other 3 exercises and you'll be doing okay. They're just fun exercises you can try to add into your workout program. I would start with 10 reps of each one of these, the low trap Y, the mid trap T, or the low trap I. I would start with 10 reps and work your way up from there if they seem pretty easy. You should always feel them in the back, right around here, not in the front. So if you're feeling pain or discomfort in the front, please stop. You can always ask me questions about the exercises. You can email me, and I'll be more than happy to send you more videos of them or go over them over a phone call or anything like that. And then just real quick, what I want to talk about is how physical therapy treatment can help. So what we would do, or what I would do personally, is lengthen the muscles that are shortened from prolonged poor posture, or just in general that are shortened. So that's usually those pec muscles I talked about, because if the shoulders are forward, the pecs get tighter, and then it stretches out the back muscles. So then work on strengthening the overly stretched muscles, which would be the back muscles. So we work together with both of those, and we want to make sure that we're focusing on stretching and strengthening the appropriate muscles. Decrease pain levels. Not everyone experiences shoulder pain, but if you are experiencing pain, that I would focus on obviously decreasing your pain levels through soft tissue work, joint mobility, showing you the exercises and stretches, stuff like that. Improve joint mobility. That's important because if the joint's not moving well, the muscles don't move as well either or work as strong. So you want to make sure that the joint is moving the way it's supposed to. And then teach awareness of posturing, because if we're strengthening the right muscles all day long, but you also sit at a computer for 8 hours a day and your posture is not great, or even when you're standing, then it kind of defeats everything we've been working on. So usually when you strengthen the muscles though, the posturing, you'll become more aware of it because the body doesn't like that new position again. So you become more aware of your poor posturing. But I make sure to teach you awareness tips like setting timers, things like that, things you should feel throughout the day to help improve your posture. And then give exercises to perform at home to continue to improve posture, improve strength, improve mobility. So kind of like those 4 exercises I showed you before, also improve. There's other exercises I will show you. There's more exercises based on your symptoms. Those are general exercises. And then I'll send you home with those to continue to work on, and then you can add them to your exercise routine. Thank you for joining my webinar. And if you have any questions, feel free to contact me. If you have any feedback, feel free to contact me. You can email me or call me. If there's anything else you'd like to see, feel free to email me as well with any ideas you may want me to go over something or something you're not sure of, or any questions you may have. Feel free to contact me. Readily available through email, phone call. So thank you for joining again, and have a good day.